Is Democratic Congressman Reid Khanna. He's calling us from the Capitol, where lawmakers are working to pass this bill. Let's start with you, Congressman, and tell us first of all about these negotiations. Donald Trump did not initially want to negotiate with the Speaker, but ultimately a negotiation did happen. Can you just walk us through that? I suppose it was with Steve Mnuchin, but just walk us through how this all played out.
Sure, Joy. We're about to vote on the package this evening, and we've been pushing for weeks to make sure that we offer free testing for anyone who wants to get a coronavirus test, that we have paid leave so that people who are sick don't feel compelled to come to work, that we are putting some resources, some financial assistance to families. I mean, when schools are closed, we need to make sure that kids are going to have a lunch, that they're going to have food security. And finally, after weeks of us saying this, the president is finally willing to engage. My sense is the reason it took so long is the White House wanted a deal. They realized they need a deal given the catering stock market. And they actually had pushback from some of the Republicans in the Senate and the House. So Mnuchin would say there's a deal. We were about to vote earlier today, and then the White House balked because of pushback with the Republicans. I think finally the president just tweeted out that he supports this. He knows he needed this deal.
Yeah, Donald Trump earlier in the press conference he did today, this is what he said, and this was before the deal was announced. This is how he spoke about the Democrats with whom he was negotiating. Take a listen.
Well, we just don't think they're giving enough. We don't think the Democrats are giving enough. We're negotiating. We thought we had something, but all of a sudden they didn't agree to certain things that they agreed to. So we could have something, but we don't think they're giving enough. They're not doing what's right for the country.
In that word salad, it sounded as if they were saying that the Democrats weren't giving enough of what? And the question is, of what? There had been talk from the president that he wanted help for hotels. Weird, he happens to also own hotels and lease out hotels. There was something they wanted for the shale oil industry. Can you just tell us, is that kind of thing in this bill?
It's absolutely not in this bill, nor is a payroll tax cut that would have helped employers. That's not in the bill. But if you notice, Joy, as you pointed out, I mean, the president didn't say what they want. It was just vague abstractions. Actually, the Democrats, one of the things we've been pushing for, Tim Ryan and I have said, let's get a $1,000 cash infusion into people who are making less than $65,000 a year. And the economists, Jason Furman and others, have said that's actually the biggest thing you could do to prevent a bad recession and to increase consumer demand. And so the Democrats have been proposing real ideas for learning the experience of 2008 and what we need to do to make sure we increase consumer demand, that the economy doesn't crash, that we're helping working families. And fortunately, the Speaker was outstanding. I mean, we basically got our priorities, and we did not give us any bailouts to industry or anything that this president was asking for corporations.
Yeah, that's good to know. And the Speaker does a very good job at this. I want to read you a little bit from a New York Times article that came out today, and it talks about the worst case estimates for U.S. coronavirus deaths. And here is what it says. Between 160 million and 214 million people in the United States could be infected over the course of the epidemic, according to one projection. That could last months or even over a year, with infections concentrated in shorter periods, staggered across time in different communities, experts said. As many as 200,000 to 1.7 million people could die. And the calculations based on the CDC scenario suggested 2.4 million to 21 million people in the United States could require hospitalization, potentially crushing the nation's medical system, which is only about 925,000 staffed hospital beds, fewer than a tenth of those for people who are critically ill. Is there anything in this bill that could ameliorate the potential burdens on our healthcare system, which does not seem at all prepared to deal with a pandemic of that magnitude?
Well, Joy, these are sobering statistics that you cite, and I do think the testing and making sure the testing is free will help. But frankly, as you pointed out in the beginning of your show, this should have been done a month ago, when everyone realized that the coronavirus was spreading in China, and people like Ron Klain, who helped stop the Ebola crisis, was out there saying this government needs to do something. Why didn't we have testing then? I mean, if the president can get expedited approval for 500,000 tests today, why wasn't all of this done for a month ago? And you know what the biggest irony is? The president in 2018 got rid. I mean, you can't invent this stuff up. He got rid of the pandemic office in the White House, the task force that was responsible for stopping exactly these type of pandemics. And you look at other countries like South Korea or Singapore that have gotten things under control. It's because they have a federal task force coordinating, a command center coordinating the response. This president hasn't had that.
Yeah, and just to give you a few bullet points for the viewers on this bill, the bill that, just tell me if this is all still what's in the bill: free coronavirus testing for everyone, for all Americans, 2 weeks of paid sick, family, and medical leave, strengthening unemployment insurance, boosting food security initiatives. All of that is in the bill. Is there anything else that I'm leaving out that people should know is in this bill?
No, that is the outline of the bill, and of course the school lunches and the food security is a big part of it. But we need more. I mean, the testing is not enough, as you pointed out. We need more beds. We need more ventilators. We need more capacity for how we're actually going to make sure that our system isn't overrun. If we had a better response a month ago, we may not have had the crisis, but we're behind the 8 ball. And so at this point, we know a lot of people will get, unfortunately, infected, and we're not prepared.
Very quickly before I let you go, I know that your district has been hard hit by this outbreak. Can you, as a member of Congress, get tested if you wanted to be tested today? Could you get tested?
I could. I mean, I imagine I could now with the new testing. I could go and get tested. I would say though that the tests still aren't prevalent enough, so people shouldn't go and get tested unless they have some risk factor or some concern, because otherwise then we may run out of tests for the people who really need them. So, I mean, this is a time, look, the government let us down, and so the best we can do is we all have to rise to the occasion, use appropriate social distancing and not be going into places that have large gatherings, being careful about washing our hands, being careful about not spreading the disease, and doing what we can to help those who are less fortunate in the community. I'm fortunate in our district, a lot of the tech leaders have stepped up to help some of the hospitals to try to build capacity, and we all need to do our part.
Congressman Khanna, thank you very much for taking some time out. I know you have to run and deal with voting tonight and the rest of the sort of outcome of this bill, so thank you. Thank you for your time.
Thank you. Thank you.